And we're here with Dana Weeks, the CEO of MedTrans Go. Only last week I missed an opportunity to engage with you, but thank you so much for sending Ashley our way for the ADIS pre-chat. It's good to have you here now. How are you describing the importance of this event, especially to the healthcare sector?
Well, I mean, it's a wonderful collection of inspiring leaders across the globe that have this wonderful connection of affiliation and I think inspiration from the continent. And being from Atlanta, Georgia, where we do have a vibrant diasporic community, I love being able to engage here in the Bay Area and engage with such a variety of folks who have come in from Africa and the very different parts, as well as many people in the States who are doing great things.
Nice. I want to ask you about knowledge transfer. Although when I had that pre-chat with Dana, she made me understand that the work that you do is very focused on the African diaspora. But because I am privy to some of the issues on the continent, particularly in the healthcare sector, where you have the lack of structure, for example, causing a lot of healthcare infrastructures to crumble. Based on what you have learned on this journey, is there any sort of framework to transfer that information to people who might want to replicate your success on the continent to sort of help structure systems back home?
Well, it's interesting, having worked and lived in Africa, there is a lot about healthcare really that is about trust and knowledge transfer to people who are aware of and kind of looking at what needs to be fixed. And I actually think what COVID showed us and what the challenges we have in the United States, they're in many ways very similar. We mask a lot of the idea that we have strong infrastructure already built here, when I believe, especially for people of color, women especially, and Black and brown women especially, healthcare was not designed with an infrastructure that is serving our populations in the ways that I think it should. And so my advice, my thought about rebuilding structures in Africa, it would be the same thing that I want to do here. What I want to be able to provide is better access, better education, and that infrastructure and resource and tool that can equitably distribute that kind of knowledge and healthcare access.
And lastly, it's day 2 of the event. I want to know, what has been that light bulb moment for you, thinking of coming from day 1, which is the welcome event, and even today. Has anything spectacular happened for you?
Well, I mean, the spectacular is those small moments, the conversations. There is a strong part of me and my heart that will always be and live in Africa. I was just actually in Africa in December in Nigeria. My husband is Nigerian, and we just getting back to the continent. There's something about the music, the food, the energy, the people that just transforms. And so that's what I get from this event. It's that transformative nature of collectively working on something, caring about something, caring for each other, that we can translate and use to really not only impact and affect our people, but I think all people. And we've always set that tone where we're leaders and making change and being a part of that wealth building and creation. And why not make sure that not only are we acknowledged for that, but that we're participating in it as well. And that's what this conference is about.
Spectacular is in the small moments. Thank you so much, Dana Weeks, and enjoy the rest of the symposium.
No problem. Very nice to chat with you.
Yes, thank you.
Bye.